Okay, so starting our class now. This class will be on the grammar. So we'll be discussing about the, like the grammatical mistakes, the range of grammar expression that is important for you to write a letter. So starting from the minor details and then starts from the salutation. Let's say these are some of the format that you can follow while writing or starting a letter, such as salutations. Dear Dr. Alex, or we can put comma afterward as well. We may miss the comma as well if you're not writing it with sincerely or faithfully at the end. Then we can see the subject line. We may write it down the patient name with title. Let's say Mr. or Mrs. can be added with that. And date of birth can also be written over here, right? And we can also write down the age as well. And then introduction part, the letter of the introduction we already have discussed. We have the background information such as name, age, or occupation. Marital status, as per the relevance, we can add the information. And the main concern should be written in the introduction as we discussed earlier. So there are certain other rules of the grammar that we have to see. It is also important for you to understand that certain components of the grammar, such as if you can see the third one, I'm writing to refer Mr. Alex or X, a 48-year-old man who presented with. So now this a 48-year-old man is called as a positive noun. We can use this in the introduction to describe the quality of the noun. We can also use, you can say, the profession of the patient. For example, an accountant as a profession of the patient. We can write it down over here as per the importance of the case. But there are two sentences you can see written. First one, that who presented with, there is no comma after man, after a positive noun. And in the second sentence, we can use comma. Why is that? Because in here, this is a defining clause, relative one. And in here, this is a non-defining clause. So when we have a non-defining clause, we can separate it with comma. A 48-year-old accountant, comma, who presented with signs and symptoms suggestive of Alzheimer's disease, then comma. So to make it more simple for you, if you can see that when you're writing a sentence and when you stop sentence over here, in that case, you can write down, let's say, no comma. But if you are continuing the sentence for further management, there should be comma between before relative clause who and after the disease, right? Anyhow, so there is something that we can say tenses in the introduction. Like we can see that which tends to be used while we are writing a letter at different part. So as a matter of fact, say this sentence, like say we can put comma over here in the non-defining, and in the defining there is no comma. Just to we have highlighted this thing so that you can understand the rule of comma, nothing else. This is your appositive noun that describes the quality of the noun, right? Anyhow, so moving on to the next one, we can also write it down. Let's say the some of the additional line. If they have mentioned something, for example, as discussed with the receptionist, as discussed with your, let's say, team, we can add in the introduction part, right? Anyhow, so politeness is an important element. Either you're writing in the introduction part or either you're writing in the conclusion part. We have to have basically politeness in your introduction. Then we can see that conclusion can also be written uh, with polite tone whenever you are writing a letter. Okay. Anyhow, so afterward, we can see there are some other rules of grammar. Let's we discuss with reference to the introduction part. In the part of the introduction, although it's a simple thing, but still we would like to discuss that. The first of all, the first and foremost thing is which tends to be used. So if we can see there that we can use simple present or past simple, maybe past perfect or past perfect continuous mostly in any of the introduction. Let's say I'm writing to refer or thank you for seeing Mr. Mark, whose sign and symptom are suggestive of diabetes mellitus. Now, this is your example of present simple tense. Now, in the next sentence, thank you for seeing. Mr. Mark. Thank you for seeing Mr. Mark. If I can see their sentence over here, who has been unresponsive to the treatment of, let's say. So now this is your present perfect continuous tense, can be used in the introduction part. Now the next sentence we have past simple and present continuous tense. Let's say, who presented today with severe chest pain, then I am referring. So you can see there are a variety of grammatical expression you can use in the introduction part to show the density of the grammar, and if you can use it appropriately, like you can see, even your introduction will be dense with reference to grammar. Like, I'm writing to refer, or thank you for seeing Mr. Mark, put comma, a 28-year-old man, an accountant. A positive noun has also been used, whose sign and symptom are suggestive of diabetes. You have used the non-defining relative clause. So there might be variety of grammatical expression can be used over here, right? So that you have an idea about the writing introduction, and you might write it down appropriately, and there might not be any grammatical mistake over here or any inappropriate sentences to be used, right? Anyhow, so after that, if you can see that in the discharge letter introduction, we have simple, let's say, we can write on past simple or present perfect most of the time, such as in the first sentence, who presented with, who presented with, who underwent a successful, underwent is your basically past simple tense. We can simply write down who underwent a successful right knee replacement surgery or whatever surgery that has been done. You can use it, right? Anyhow, so afterward, if you can see there, the second example, who has responded well to the treatment or who has been responding well to treatment. Now, these are two examples of the tenses that we can use in present simple form or past simple form as well. Now, coming towards your question that you have asked in the chat, ma'am, regarding the comma point, if we are using the non-defining clause, such as in the first example, whose signs symptoms are suggestive of diabetes mellitus, now this relative clause is now non-defining, so we can separate this non-defining clause at both ends with the help of comma. But if you are using a defining clause, let's say in this sentence, who presented today with severe chest pain and heavy wheeze. Now, basically, this is your defining clause. So there is no comma before who clause. Is it clear to you? We can see that in social plus past medical history, where to write, that is another debate. Where to write, that is another debate. But we can see that uh, you have to write it down, the things that are related to the patient, such as habits, such as hobbies, let's say. We have to write it down in the present simple form if there is no time frame mentioned. If there is no time frame mentioned, we can simply write it down in the present simple tense. Let's say he's a smoker, he's a drinker, and so on. So these are just an example that you have to follow when you are writing the social history in the let's say letter. But when we have the time frame being mentioned, in that regard, you need to see, you just have to write it down, let's say the present perfect continuous tense, if we have the time frame being mentioned over here, right? So depending upon the importance of the information, we may write it down, the things, right? And secondly, we can write it down the past simple or past perfect tense even in the social history part. If there is something that is related to past, we can write it down about the past simple tense, right? Is it clear to you? Okay. So after that, we have the next slide before we can move on. If you like to ask any. Now, basically, if you can see there, uh, we have the treatment record, or we have the ward history, let's say. So these things, if we have a treatment record or we have the ward history, this can be written in mostly in past simple tense. mostly in past simple tense. If we have the treatment record or in the referral letter, let's say if, all the visits before today can be written in the past simple tense, right? Can be written in the past simple tense. Or when we have a relationship, when we have a relationship, then and only then we can make a comparison of past simple and maybe past perfect together. So there are a few examples for you that has been given in front of you. Let's say in here, if you can see that we have the, let's say we have the Mr. XYZ initially presented on this date. He visited with the complaint of, or he had. So we have used the past simple, and then the event that had happened this before this visit, we are using the let's say past perfect tense, right? So we can use, let's say Mr. Andrew visited with the complaints of mild abdominal pain. He had 2 episodes. Similarly, if there is a progression of disease or the repetition of the event, you can write it down. Maybe over a period of 3 weeks, Mr. Alex had visited us 3 times. So we had visited 3 times with mild exertional chest pain. So we can write it down maybe in the past tense because that was 3 visits, repetition of event, but in the past time. So we have used the past perfect tense. And all of his investigations, including ECG, were normal, except exercise tolerance test, which revealed some ischemic changes. So you can see that how can we use variety of sentence in the same paragraph. So similarly, he had uneven stay in ward and had blood transfusion. So these 2 tenses we have used in the ward with the past perfect, and he was becoming gradually stable. After that event, he was shifted again after that ward where the rehabilitation program has helped. Now this is a recent event. So within the same paragraph, we can see that how we can use the variety of sentences to show the difference of event had happened at different time, right? According to the importance of the event, we can use the sentences differently. Okay, is it clear to you?
Sir, sometimes we use the word times like
The tenses that we can use while writing the today's visit or the discharge plan. Tenses that we use while writing the today's visit or the discharge plan, right? So first of all, you can see there that in the today's visit, mostly we can write down the past simple, right? Let's say today he presented with the same complaint. This is one of the most frequently asked question that has been asked by the candidates, that why we should use the past simple tense when we are writing today. So to answer this question, even when you're writing a letter, at that time it was the near past, so we can use the past simple. And similarly, if there is a improvement in the condition or the worsening of the condition or the thing started from the past, if either finish in the present or it's basically improved in the present or worsened in the present, we can use the present uh, perfect tense. For example, on today's consultation, his condition has worsened. We have used the present perfect tense. So even for the plan, we can use passive voice form of the present perfect. He has been transferred to the emergency department. GTN patch has been applied, has been given like that. For the discharge letter, we can use the, let's say, for the discharge letter, we can use, let's say, this thing, uh, future tense, present simple tense, maybe. Okay. Okay. And basically, let's say she is widely stable and is ready to be discharged. I would appreciate if you could ensure that, let's say, it's a polite request. And similarly, she will be discharged tomorrow, future tense, as she has recovered, present perfect tense. Her discharge medication includes present simple tense, can be used. Okay. Is it clear to you? So these are some of the example that which tends to be used in the present tense and conclusion as well. So basically, we will be discussing tense is the present perfect tense. Let's say I have treated Mr. James at this hospital for 3 years. This is an example of your present perfect tense that we can use over here, right? We've been treating Mr. James at hospital for 3 years again, present perfect continuous tense. So basically, the common errors most of the candidates do they make actually in the writing a letter. First of all, the first and foremost common error is the use of for, since at the right place. Let's say when we have a period of time without there is you can say when there is a period of time without the start of period being mentioned, we can use the uh, for that, right? And whenever we have a period of time when the start of period is mentioned, we can use the since for that. And if we have a period of time that explain the repetition of the event or the progression or change in condition, we can use our with that. Let's say over a period of 3 months, 2 weeks, 3 weeks, we can use for that. Yeah, sure. Basically, when we have a period of time, when there is no start is being mentioned, we can use our for that. And when we have a period of time, there is a start being mentioned, we can use, let's say, like since. And when we have a repetition of the event, like it's happening time and again, we can use, let's say, our with that. Let's say over a period of 3 months, he had visited us 3 times, 4 times, 5 times. It's a repetition event. Over a period of 2 weeks, his condition has worsened. Or like we can write it down in this way when we have to mention about the worsening of the condition, about the repetition of the event, we can use these tenses, right? Anyhow, so these are few examples
Sir,
for our as well.
sir, can you repeat please because it's a little bit confusing. Why we are using here has and had both for the Mr. Mark?
One name, come again, ma'am. Which one you are asking?
Describe a period of time
Mm-hmm.
Mr. Mark has had diabetes for the last 3 years, right?
Yes. Yeah. So,
Why
what was
can't we use only one like has or had? Like it's a
again common tenses we are discussing? Now, past perfect tense can also be used in combination with past simple tense while writing a letter. Mostly, past perfect tense can be used when we are making a comparison of two events that had happened in the past. Specifically speaking, in the body of the letter, while writing either in case of referral, either maybe 2 to 3 visits when you're writing together, when you make a comparison with reference to time of two events to segregate the far past and near past, you can use the past perfect tense. Just take an example. She had not been able to conceive over the previous 4 months, and as a result, she was suffering from depression. Let's say. So here we can use an example. She was not able to conceive, then she became depressed. Similarly, she reported that she had seen, not been, sorry, she had seen blood in the toilet bowl on 2 occasions. So, this is an example of past perfect tense. So we can use, let's say, although he had attended physio session for 4 months, his range of motion did not improve. So we can use the two tenses parallel in your writing. Same is the concept for discharge letter, specifically when you have to compare two events in the past, either in the ward stay or in the rehabilitation. We can differentiate those two events with the help of past perfect tense and past simple. The rule is simple. We can use the second, like third form with the past perfect tense. Now we have the articles use. Articles such as a, and the can be used in your writing letter, and their appropriate use can help you to lift your score in OET writing. So, first of all, accountable singular noun can be, we can use a before that, accountable single noun, right? Before that noun. And we have to understand what are the countable nouns, such as complain is a countable noun, such as abscess, lump, these are countable noun. Even the symptoms such as fever, because they run in episode, such as cough, they run in episode, let's say urination, and so on. All these things are the example of the countable noun, right? All these things are the example of the countable noun. So you can see there, you can write it down, the countable noun, let's say, and we have to use the article before that. Afterward, if you can see there, afterward, if you can see there, then we have another example. If to use the, let's say, an before that. So we can use an, let's say, we can use also an when we have a vowel sound, the things that will give you sound of vowel, such as A, E, I, O, U. These are the vowel sound. So let's say the article an can be used. For example, the patient has an abscess. We can use it will give you a vowel sound, an MRI, an X-ray. These are the things that we can use and before that, right? And we should not use any vowel if it's uncountable or it's a plural noun. So the use of definite articles, we have to use the before the body parts, before when you have to specify something, before the word following, same, similar. Okay, when you want to specify something, when you have to like highlight something, we can use article the before that. An article can be used without with normalization. For example, this patient is complaining of discomfort during the passing of urine. Let's say when normalization means when you change the noun to noun phrase, right? This is a concept, a process where the verb can be turned into the noun phrase is called as a normalization, right? We have to use the before that. This is a grammar rule that we must remember. And if you don't able to understand this thing is, you can simply ignore it. Maybe because it's better to not to make mistake rather than you can say writing it wrongly. And name of disease, we should not use any article with name of disease, neither a or neither the, right? We should not use any name of disease. No article with the gerund form, ing form. Okay. So capitalization. For the capitalization, we have to see.
Sir, I have one question, sir, if you can.
Just a minute, sir. Rule of capitalization. If we have the medication name and if it's a basically brand name, we can use the capital letter first, uppercase. And if we have the trade name, then we can use the let's say sorry salt name, then we can use the lowercase letter. Similarly, when we have a disease, if it's name against a scientist such as Parkinson and Alzheimer, we can use the capital letter first, like uppercase the first letter. And if we have the let's say simple other diseases such as your like diabetes, hypertension, and so on, you can use the lowercase letter. Medical procedures can be in the lowercase. Body parts can be in the lowercase. Job titles in uppercase. We have to use the days, months, year in the uppercase, right? So we can see there that these are few of the examples that you have to see of the capital letter. Even the days, like say Monday, Tuesday, Wednesday, it should be in the uppercase. Special days such as Christmas days, it should be in the uppercase. That is followed by the active and passive transformation. Though we have to write it down active and passive voice in the letter, there will be a variety of sentences. In a formal writing, we prefer to use the passive voice. How to use it and where to use it depends on the scenario. let's say the way the case note has been written, but you need to understand that few of the transformation like past tense can be changed to, right? Let's say there are few examples that can be changed. So then we can see that after active to passive, the clauses in the sentence, we have different clauses, such as clause of contrast. Whenever we have to use, let's say, whenever we have to use the contrast in a sentence, we must use the clause of contrast over here. So, what I'm trying to tell you that let's say rather than using but time and again, we can add although, even though, despite, in spite, however, and so on. This is just an example. Let's say although he has been given this medicine, his condition is not improving, right? For example, despite he was prescribed this medicine, his condition did not improve, and so on. Similarly, for the purpose clause, when something had action that was taken in the past and the consequences can be in the future, let's say, or when we have some time difference in the event, let's say, in order to relieve his pain, he was advised to join gym, let's say, or he has been advised to join gym so that his weight can be reduced. So these are few examples for you so that you can understand like where to use the clause of purpose. Though we have reason clause can be replaced with the clause of purpose as well. Due to the fact he was overweight, he was advised to join gym, or due to the excessive bleeding, he was transfused blood. So these are a few examples for you for your better understanding. We can see for time clauses, let's say at the time of admission, at the time of discharge, initially, let's say these words such as ago, while, when, where, on the next visit. These are the time clauses that we can use over here in the writing task. So the sentence composition, let's say we are using the compound sentences also in your OET writing. Compounding can be done based on the similar idea. The same topic can be compounded together, and we can use the word like and, but, and so, right? Such as, let's say he's a smoker and drinker from the same group. We can use as a compound sentence. We can use but, let's say, we have to use but, for example, when we have a contrast as a compound sentence. Then there's a concept of parallel structure and balance sentences. We have to use the same form of the noun, let's say, sorry, verb in a sentence. Let's say if you are using active verb in a sentence, so in the whole sentence, you have to use the active verb. For example, he's no worried about his condition because he is overweight, active form, lacks exercise, and smokes regularly. Now, another example for passive form, during hospitalization, IV fluids were commenced, and a transdermal patch was used for her pain. Let's say, and same is the example with noun phrase, with gerunds and preposition, and so on. So complex sentences, compound, simple, active, passive, all are appreciated actually if you can use it appropriately. So let's say these are few examples of complex sentence with the rule of comma being explained in these two sentences. Although he has been taking painkiller, comma, his pain is not settling. The grammar rule is that I'm using has been over here, like present perfect continuous tense and then present continuous. And if this the first one is basically you can say I'm starting the sentence with the clause although it means that it was your dependent clause and then followed by the independent clause. So we use when we use the dependent clause first and dependent afterward, we have to use comma in between. But when you're using independent clause first, like say his pain is not settling, although he has been taking painkiller, so we should not use any comma. And conditional sentences are also appreciated, such as the last few sentences. If you have any further queries, please do not hesitate to contact me and so on. So this was a brief